Good afternoon to all. I am Dr. Prasad Babu, Deputy Director, IGNOU Regional Center, Vijayawada. Already we have scheduled MA Counseling Psychology in India. Practical theory counseling schedule sent to all the learners. Now, already Friday we have conducted one session, and today we have MPCE-21, and again we have the session third and fourth also. Fourth and fifth, I think, fourth and fifth. So fourth, madam will take Sangeeta madam, and fifth and sixth, Vimla madam will take the MPC 46. So today 20 MPC 21 and fourth or third. Exactly, I don't know. We see the timetable and we'll conduct the session. Third, fourth, fifth, sixth, I think. We'll see. Today we have MPCE 21. 2:30 to 4:30 the session will continue. Dr. Sangeeta Madam is the Associate Professor in Psychology, the Department of Psychology, Getam University. Madam has been associated with IGNOU, Vijayawada for last 12 to 15 years, and she has been taking continuously for the last 15 years for MA Psychology students. So today, madam will take the counseling psychology, MPCE 21. So, madam, now we can continue, madam. Take this session.
Okay. Okay, sir.
And if you have any doubts, you can raise your doubts last 10 or 15 minutes. In between, don't raise any questions. Madam will continue last 10 to 15 minutes query session. So whatever queries or doubts, you can write it on paper and ask all the your queries or doubts or suggestions last 10 or 15 minutes. Thank you.
Thank you, Dr. Prasad, for having me here to deliver the facilitation session. Yeah, facilitating, right, of the course MPCE 021, which is counseling psychology. So I understand apart from you, the RC and me, there are only 4 students, but as you rightly said, yeah, we need to start on time. The time allocated to us for this interaction is 2 hours, 2:30 to 4:30. I will stop my lecture at 4:15 so that we can have a wrap up and we can also interact. If at all you have any questions, you can raise those questions and we can discuss. But let me tell you one thing in the very outset. This is just a facilitating session. We cannot be able to take in depth, right? And then counseling and psychotherapy or counseling psychology is a very intense paper that gives you the much needed foundation. And let me tell you one thing, the material that is provided by IGNOU covers almost everything that you need to know in the subject, right, according to the syllabus that is provided. And one more happy thing that I had felt about being associated with IGNOU is, on LinkedIn, I had come across a post by an MA student who was sharing her happiness on clearing the JRF. So she said, who says distance education students cannot clear net and all? So she was just setting a very good example, wonderful example, stating that if we study with commitment, we can become anything that we want. And so this MAPC program is a very intense program, a lot of rigor, and the same holds good with counseling psychology as well. So we will just go down what all are included in your course right now. As with the other papers that are there, we have 4 blocks. The entire course is divided into 4 blocks. And block 1 talks about introduction, under which we have Block 1 talks about introduction, block 2 talks about counseling models and various approaches, block 3 talks about different types of counseling, and block 4 talks about counseling for mental disorders, right? So when we take a look at each of these blocks in depth, block 1 we said is introduction to counseling psychology. So, Unit 1 talks about introduction to counseling. What are the various characteristics of the counselor? Unit 2 is all about the process of counseling. Unit 3 is all about theoretical approaches to counseling. Then we have Unit 4, which covers ethics in counseling. So, why are ethics very important? So, psychology is a field that deals with a lot of mental aspects of people, right? So these mental aspects could be or mental problems or issues could arise out of behavioral issues or emotional issues or social issues that each one of us has, right? So by talking about ethics, we are getting into a bond with our own principles and the principles that are laid out for the field of counseling psychology, right? So supposing say Miss Padma comes to me for counseling, I should not carry the same details and every matter of Miss Padma to others and discuss Padma in public. Well, if I have a doubt, I can carry forward her case but not reveal her identity. It is This is just a singular example that I'm talking about, but counselors are bound by lot many ethics that they need to adhere to while they are counseling their clients. So in counseling we call the people who come and see the counselors as clients, right? And while doing practicals, I think we call them as subjects. We used to call them as subjects, but now there has been a standard guidelines which said you will no longer refer to them as subjects, but you will call them your respondents. Okay. So block 2, moving on, block 2 talks about counseling models and approaches. You all would have covered a lot about Freud and psychoanalysis, right? And while understanding psychoanalysis, I'm sure you would have come across the fact that Freud came up with his school of thought because he was dealing with a number of patients, right? And one more thing about Freud is he has made a lot of I mean he came up with a lot of concepts, but all these were tested mostly, or these concepts were arrived at after his association with his male patients. Not much of work has been done with women, right? So psychoanalysis is one counseling model that we have. Psychodynamic is another. Then psychodynamic and psychotherapy. Then we have behavioral therapy. After that we have cognitive behavioral therapy and various other approaches to counseling. So these are all very traditional ones. Now there are more and more forms of therapy that are making their own way into the counseling and psychotherapy space. And one such thing that your course talks about is drama therapy and art therapy. I don't know how many of you have heard about mandala art, right? So these are designs which the which the person or the client can use in order to overcome his uh, anxiety or depression, or it all depends on what the counselor suggests to the client, right? So drama therapy and art therapy, how they contribute to the field of counseling. Then there are also other therapies which are person centered counseling and solution focused counseling. So this is all about your block 2. Moving on to block 3, we see that it is titled as types of counseling. So what are these types of counseling? Earlier we spoke about various models of counseling. How do we handle a particular problem? Do we use the psychodynamic method? Do we use the psychotherapy method? Do we use the CBT, or is it ideal to use REBT and DBT, SFBT? So many therapies are available. and who can use these? Are we all equipped to use these therapies just with a master's degree? We will talk about all these in depth when we are covering those topics, at least superficially, right? So under types of counseling, we are going to touch upon HIV AIDS counseling, then educational and vocational counseling, child protection and child rights counseling, addiction and anxiety counseling, right? So after this, we are moving on to block 4 and the last one. It is counseling for mental disorders. How do we counsel depression patients, and how do we counsel someone who has a personality disorder, gender identity disorder, and eating disorder? So this is what your entire course MPCE 021 on counseling psychology will deal with. So after taking the inputs from the class here, I strongly recommend that you please go through the uh, notes that you have, the IGNOU notes that you have, so that you are able to get really good understanding. I'm not talking about passing the exam. Passing anybody can do, but you will have good fundamentals foundation once you do this particular course, right? So I want to keep it interactive, and I'd really appreciate if at least one or two of you can contribute to whatever I am asking as and when needed. Okay. So, with some kind of background that you've had so far, you finished your first year, you've already heard couple of courses in your second year. I want to get a feeler as to what is your understanding of counseling. Any one of you? What do you understand by counseling? It's okay, you can feel comfortable to respond in whichever language you are comfortable in. This interaction is just a reinforcement for me so that I also know you are on the same page as I am. Prashant Garu, Deepika, Priya, Rajesh Garu, Praveena. Yes, Priya.
Counseling is a kind of guidance, ma'am.
Okay. So you have given me the point to take the lecture further. Uh, we will just understand what is the basic difference between counseling and guidance. What is guidance? Who will need guidance?
Who
Who
are
will
at a
need
point
guidance?
to make any decision or who are stressed out or
You think people who are stressed out will need guidance? Okay, fine. So, guidance is given to someone who is not there in a problem already. So, this could be a pre problem stage, and counseling is given to someone who is already in the problem. Clear?
yes, ma'am.
Yeah. So, yeah, Praveena says who are not able to find their solutions. So, for instance, someone comes to us and says, I want to, I'm confused about my master's program, right? And then I do not know where to go. So, he is seeking some kind of a guidance, right? And if he is in a problem while doing the course, then he needs some kind of a counseling. So, how can we define counseling as? Is counseling a one way process or a two-way process? Uh, Counseling generally focuses on the development of an individual, and it seriously works on preventing any serious mental health problems. And you may be hearing the terms counseling, guidance, and psychotherapy almost synonymously. but we will also look at the basic differences that exist between these three. And as MA Psychology students, you should not be using them interchangeably that easily at all, right? So counseling generally is performed face to face and is confidential in nature, takes place between the counselor and the client, right? So some people would not feel comfortable to come face to face with the counselor, so they can opt for the telephonic counseling, and then sometimes they can write down their problem and uh, send an anonymous, for instance, when we take the feedback from students, when the students give us feedback, they don't want to give the feedback because they are scared where the faculty might hold a grudge if they blurt out the truth. So in order to overcome that kind of a hurdle from the student side, what I generally say is, keep your feedback anonymous and give your genuine feedback, right? So that the feedback that we receive, we can make good use of it and then try to modify our own approach towards the sessions, right? Similarly, this could be used, anonymity and writing could be used when people do not want to actually own up their problem but still are looking for some kind of a solution. And now with the internet, um, counseling is definitely happening online as well, right? Like, see how we are learning about counseling, we are doing it through the online platform. So counseling can take various formats to bring a person to a better understanding of himself and the problem that he is dealing with. So what kind of, there are a lot many things that go on into counseling. The counselor talks with the client in a way that helps the client solve a problem or overcome his problem or take a different perspective at the problem that he is in, right? So whenever there is a crisis, people go seek counseling, and it is a process where one explores his own problem and understands the problem and the stresses the idea of professional relationship brings about, because this is a professional relationship that the counselor and the client are getting into, and sometimes it is of a shorter duration, but if the problem is intense, there is every possibility that it can run into a long term relation, right? So counseling is a profession now, a huge profession, a huge demand in profession, and it deals with a varied variety of concerns: personal problems, social problems, vocational empowerment, and educational concerns. And counseling is conducted with people who are considered to function within the normal range. So, who comes to the counselor? So, someone who is having some kind of glitches in his day to day functioning, because serious psychological issues, yeah, serious psychological issues, they need to visit a psychiatrist, right? So counseling is a process where clients learn how to make decisions, clients learn how to own up for whatever they are experiencing, and also with the help of the counselor, uh, be able to take a decision. And remember one thing, the counselor is not making the decision for the client. The counselor is only suggesting the various possibilities that are existing for the client, right? So yeah, like one of you have already mentioned, it is some kind of a guidance given to the person who seeks the help. So what is guidance? Guidance is like some kind of help that is given to an individual to understand and arrive at a decision, so that he can be better adjusted, right? So under someone's guidance, under someone's supervision, under someone's direction, under someone's professional leadership, right? We seek their guidance. So they are offering us suggestions how to go about various alternatives. But you will say that counseling is also suggestion. That is what you've just now told. But in addition to giving suggestions, counseling also tries to teach various methods for reaching our goals, and it will help us determine what our goals are. Okay, so while we are practicing, we will understand that there is not much of a difference between counseling and guidance, but we can clearly say that guidance is something that comes in pre-problem stage. There is no specific problem with the individual. Counseling comes in post the problem. So a problem has been experienced by the individual, and so he is seeking the help of a counselor to address the problem, right? So with the help of the counselor's suggestions, perhaps he will be able to take a better decision. So counseling, you can say, is not giving opinion, instruction or advice, but it is facilitative listening and questioning by the counselor to allow the client to make the right kind of a decision. So the model on which counseling is based is that of a wellness model rather than a medical model. Okay, so this is the major distinction that you need to understand between counseling and guidance. Then, like I mentioned earlier, counseling, guidance, and psychotherapy are used interchangeably. But there is a slight distinction between all these three. Just now we have looked into what is the distinction between counseling and guidance. We will now take a look at what is the distinction between counseling and psychotherapy, right? So what is psychotherapy? It is an interpersonal relationship which the trained psychotherapists use in order to help a client or a patient who is there in some kind of a problem. So it focuses on serious problems that are associated with the individual himself, or the conflicts that he is facing, or the personal issues that he is facing. So psychotherapy emphasizes on the past more than the present. Psychotherapy gives a lot of insight than bringing about change. And in psychotherapy, we see that the role of the therapist is not really huge, but he is the ultimate expert, right? So when we are talking about counseling and psychotherapy, we need to understand that counseling is done for a shorter duration and less intense of the problems, and psychotherapy involves a long-term duration which focuses on reconstructive change. It brings about a lot of reconstruction in the thought process, in the behavior, in the emotional makeup of the client. So one thing we need to understand here is counseling is offered only in the outpatient setting, but psychotherapy can be provided in both inpatient as well as outpatient settings. So who can be a good counselor? There are numerous meanings that are associated with counseling, and one who offers counseling services is called a counselor. And yeah, who can be a counselor? How many types of counselors are available? It is not essential that only a person who takes clinical psychology can become a psychologist or a counselor. A counseling psychologist need not be only a person who has done psychology counseling in psychology course, or it could be a social worker also, and the person can specialize in a lot of areas, and he can become a family counselor, a marital relationship counselor. And under relationship, mind you, it is not just a marital relationship, it could be relationship between any two people, right? So a psychiatrist also can counsel, but we all know very well that these people do not have as much time to sit and give counseling sessions. So ideally, if a counselor couples up with the psychiatrist, that is a wonderful combination, right? And when we are talking about marital counseling, couples who go in for divorce, yeah, they also see counselors, right? So sometimes the lawyers also play the role of counselors. Okay. So these counselors have the knack to identify negative thinking patterns like feelings of sadness, depression, or anxiety, right? And then they encourage the client to build upon personal strengths. They suggest various skills that can be that can help them overcome their condition. So he will, a very good counselor will be able to make positive changes in the lives of the clients. So there are certain characteristics that a counselor needs to have, and first and foremost, active listening is one skill he needs to show. Because someone comes with a problem, we cannot start off saying, I know your generation is always like this. They have never given any importance to what the parents say. The counselor cannot get onto that tone at all. The client is coming because he is experiencing some kind of a problem in his life. So, as a counselor, we cannot just jump onto the problem and say, you are the culprit, because of you, the entire generation has become like that, right? So, the counselor needs to be equipped with advanced listening skills. And you will see many a times when the problem is expressed to someone, we feel so relieved. We arrive at an understanding. Okay, while we are expressing some thought strikes and some perspective strikes, and we are like, okay, I can handle it this way. Or once you have shared the entire problem with the counselor, you may also feel that you may also see that the counselor gives you another perspective that will ease out all your problem, right? So rather than just barging on to what the client is saying, the counselor should ideally listen, right? So a good characteristic of a counselor is to not disturb the client whenever he wants to express something, and he needs to encourage the client to open up as much as possible, because effective communication is one thing that helps solve a lot of problems, right? So communication between the two plays a very, very key role in trying to get down to the root of the problem. So counseling generally takes place in a very conversational style. So if you remove the big words, and if you remove the dull face, there are so many other things also from where the counselor can get a lot of cues. Okay. And one more thing, the counselor needs to be very assertive. So sometimes it also so happens that some clients come in just to take the counselor on a ride. Let's see how this person reacts to my problem. I will share one particular experience of mine. I am a part of one particular website, and the website has quite a number of psychologists. So, how do clients book their sessions through a website? So, they will go through the profiles of various counselors and psychologists that are available, and then they will book for a session with that particular counselor. So, one day there was this guy who said to me, నేను ఇంచుమించు అందరి దగ్గర సెషన్స్ తీసుకున్నానండి. మీ దగ్గరే తీసుకోలేదు. సో ఎలా ఉంటుంది అని ఒకసారి చూడ్డానికని వచ్చాను. And remember, this is an online session, okay? So I was like, what is he trying to do? Is he trying to test the capability of the counselor? What is the kind of a problem he had mentioned? He was trying to decide whether this counselor is good or that counselor is good, right? So he works for a company that takes care of their psychological needs, so he doesn't have to pay out of his pocket, but the company takes care of their mental health needs as well, right? So counseling as a career also can be extremely challenging, because not all clients are going to be good clients. Some are like over enthusiastic clients, and some are like, okay, let me see what is the depth of the knowledge that this counselor has. So we need to be guarded for all such kinds of clients. So one basic thing is to be assertive with any kind of a client, right? And then we also need to have the ability to confront the client when they are therapeutically, whenever it is appropriate therapeutically. So the counselors must be competent in their communication, and they should have that zeal to be patient enough to listen to the problems of others and give them suggestions as to how they could maneuver through their problems, right? So at this juncture, it becomes really important that the counselors understand the impact they have on the lives of the clients. And one basic or fundamental thing about counseling is confidentiality. So like I was mentioning about one example that I had just mentioned in the beginning, you cannot take the names of your clients and explain cases to someone else, right? So you will not talk about your clients outside of your office. This is a strict rule that you are bound to as long as you are practicing counseling, right? So clients must be able to trust the counselor. They should have the faith in the therapeutic relationship if growth needs to occur. So someone who is coming to us for counseling will repose a lot of confidence in us and disclose everything that is happening in their lives, right? So they need to establish that kind of a credibility. Now, what are the qualifications of a counselor? So there are certain training requirements and education requirements for counselors, and these are very clearly delineated in the Western countries. Every state has a specialty, and we see that whether it is in the West or the East, a master's degree is mandatory to become a counselor. Now, can every psychology person become a counselor? It depends. But then we need to have the license to be able to establish ourselves as a practicing counselor. So, what kind of a licensing is required? So, rehabilitation psychologists, counseling psychologists, we have the RCI approval, RCI registered. I think your regional Dr. Prasad Babu sir, he is RCI approved, right? I am not approved by RCI because I do not go into that realm, and I just call myself as a consultant psychologist. But now we have a move by the government, NCAHP, National Council of Allied Health Professionals. So what does this mean? We all, the counselors, psychologists, everybody comes under the allied health services. So we are called allied health professionals, and if we are practicing, it is essential that we register ourselves with the Council of Allied Health Professionals, because like RCI, I think the government's initiative also is to increase this kind of a community so that we are of more help to people who are having some kind of mental health issues. So, yeah. Um, for instance, if you want to go in for career counseling and educational counseling or vocational guidance, a master's degree is usually required to be licensed and certified as a counselor, right? Fields of study may include college student affairs, secondary school counseling, then sometimes gerontological counseling. What is gerontology? A field that exclusively caters to the old age people, right? And then IGNOU itself offers another course, MCFT, Masters in Counseling and Family Therapy, right? So, yeah. Then we have substance use or addictions. About the substance use and addiction, NIMHANS offers a certificate course, right? What is NIMHANS? It's a top rated and probably the best in the first institution in India for psychologists, right? It's there in Bangalore. Then
Bangalore.
yeah. So any program, getting into NIMHANS itself is very difficult. So just see if you are able to get your hands on any of the certificate programs, visit their website, and yeah, similarly MCFT from IGNOU. If at all you are really interested in making counseling as your career, you will also have to identify a niche area for yourselves. Whom will you counsel, right? So whether it is the gerontology field, in the sense old people, or marriage counseling, or adolescent counseling, so depending on that you can further go into a niche specialization, right? uh, yeah, so this is about it, and now we will slowly move on to another topic. Yeah, getting license is highly essential. You can practice without any doubt if you are RCI certified. RCI is Rehabilitation Council of India, and this was set up in 1986, right? And the act this particular act monitors the services that are given to people with disability. Like I was saying, there are so many people out there who are having learning disabilities, communication issues, right? ADHD, and all these kinds of cases that I have listed just now. Special educators can definitely contribute a lot, right? So from how can you become a special educator, do any of the RCI certified courses. Actually, IGNOU had earlier had a course on rehabilitation psychology. If you had done that course, you would be RCI certified, but sad that it had discontinued the course, right? So RCI trains master trainers, rehabilitation professionals, and people for creating better service delivery facilities for the people with disability. And there are also RCI sponsored training courses, where and these courses are offered at various universities and institutions. So if you do these courses from those universities, you all automatically become an RCI approved psychologist. Like in Hyderabad, we have Swikar Upkar, and Amity University is also offering RCI certified courses, right? So it is for you to decide if you really want to become a practicing counselor. So a counselor should be a man of values, and should be able to stick to whatever he is promising to the client. So the process of counseling, there are various steps in the counseling process. There are different stages of counseling process, and then what are the various counseling process followed by counselors. And there is a procedure in counseling process, how to develop a relationship with the client, how to work with the client, and how to terminate a relationship. So whenever a client comes, you have to contribute so much into the relationship that he comes back to you till the problem is solved. And once the problem is solved, you also should be able to terminate the entire process, right? And there are various factors that influence the counseling process. There is a structure, there is an initiative, setting, and client qualities, as well as the counselor's qualities. So the process of counseling, or the counseling process, starts off whenever there is someone who visits the counselor with a kind of a problem. So who comes to the counselor? How do they come to the counselor? Especially in our country, in our country, if someone visits the physician or a doctor, they keep telling everybody that, yeah, I had gone to the doctor and all. But same, if they visit a psychologist, they want to keep it hush hush. They don't want to tell people that they've gone to a counselor. I mean, the taboo or the stigma is so high still, that people, and half the time they do not understand that they can visit a counselor to solve this kind of a problem, right? So there is still a lot of awareness that needs to come in the people's mind, so that they can avail the services of a counselor and be out of the problem that they are experiencing. So counseling is a process which has a beginning, which has a middle, and has an end. So the counselor facilitates for the client to consider the aspects of his life that he wishes to change, right? So the entire idea is to enable the client to explore a problem that he is facing, offering assistance to the client at any juncture that the counselor feels is needed, right? So it is definitely not a condition where the counselor will say, you have to do like this, you should not do like that, right? It is definitely not a thing where he can give advice. So there are various models of counseling, different routes that the counselor can take to bring about the change in the client, right? For instance, we will just talk briefly about transactional analysis. What is transactional analysis? It says that each one of us has uh, three shades in us. We can operate from the parent level, we can operate from the adult level, or we can operate from the child level. So transaction analysis gives us an understanding into the personality, into the relationships that we have, and the kind of communication we are going out. So generally in transactional analysis counseling, people talk about their parent, adult, and child. So these are all distinctive parts of us, right? So when we are talking to our thickest friend, we would probably talk at the child level, right? When we are addressing our children, parent level. And when we are doing it at a very very sober level, we are doing it at the adult level, right? So everybody has an intrinsic dignity and worth. When everything is fine, we are fine, right? But sometimes we need to change. And all that, transaction analysis is like, what is the interaction between people? Are they responding from the same levels, or are they responding at different levels? So a lot of it have a lot of problems arise when both the people are not on the same platform, right? So the counselor offers support and facilitation on the basis that the client has decided and what he or she feels, right? So here we are talking about different stages of the counseling process. First and foremost, identify the need for counseling. Second, prepare for counseling. Third, conduct the counseling. And fourth, follow up. Generally, what happens is whenever a doctor writes a prescription and asks us to come back after a week, if we are out of the problem, we generally do not go back, right? The same thing happens even while counseling. You attend one or two sessions and you are not so serious after the subsequent sessions, So one needs to really understand that this also is like a course, and one has to go through the entire process and terminate it in a systematic manner. So what is the process that the counselors generally follow? You will see that the clients do not come out of their own volition. They come there because someone has taken an appointment for them, or they come there because they were forced to go. And if someone was forced to come to the counselor, breaking through that wall becomes really difficult, right? So recently I am seeing a couple for counseling. Both of them are married for 11 years, and they have a 11-year-old 6-year-old son. And right now they just want to part ways, but both of them have decided that if we take counseling, probably we can stay together for the sake of our son. As the son is very small, they feel if the parents separate now, it will have a very bad impact on his growing up or developmental stage. Okay, so here both of them do not have a problem of opening up, because it struck their mind that they can go and talk to a counselor. So they are like he is sharing about all the problems that he is facing with her, and she is also sharing the same thing. So one joint session with them, I told, no, let's do separate sessions for the two of you. Then they said, yeah, sounds good. And then when they knew that the other partner was not there, they were going on talking about each one about their own sob stories about their partner. So you see, counseling is all about openness of the client to be able to share the information, right? Yeah, we collect all the background information, then we try to identify what are the core issues, then formulate the case, and then we as counselors will have an idea as to what is the goal that the client needs to reach, and what is the intervention that as a counselor I can implement and make my client reach the goal. And once the intervention is implemented, I will evaluate whether the intervention is going in the right direction or no, and then bring it to a closure, right? So we have the initial interview, and then at the end of the initial interview, the client and the counselor will decide on certain options, whether they need any further counseling at all, how many appointments are needed, and what are the other alternatives that are available to them, right? So not all counselors use the same kind of an approach. Each one adheres to their own kind of approaches, right? So different counselors will place different levels of emphasis on the behavior or thinking patterns or the emotional aspects, right? And one thing we need to understand is the results out of counseling sessions cannot happen overnight. See, if we are suffering from fever, we take a crocin or a dolo. Within 6 hours, even before 6 hours, or just within an hour, our fever or temperature subsides. But counseling is not like that. The change does not come about very quickly for majority of the people, right? Because the duration of the treatment or duration of the session depends on quite a number of aspects. So it depends on the severity of the problem, it depends on the motivation of the client, depends on the type of a problem, it depends on the age of the client, right? So we need to, as counselors, first establish a safe and trustworthy environment, trusting environment for the client to make him feel he wants to come back and share his agony with the counselor. So sometimes what happens, they come to the counselor, and because they have someone who's listening, who is all ears, they start crying and they feel so helpless. So do not disturb the client in such a condition, because he is just going through a catharsis phase. Listen to everything that the client has to say, and then paraphrase. What is paraphrase? He says something, you nod your head and repeat the same thing. So the client will understand that you are on the same page as he is. So whatever the problem that the client suggests, you turn that statement into a goal statement. What are the various approaches that are available to these goals? Help the people choose. Help them choose, but you as a counselor do not choose for them. Right? So you get the feedback of the client and then confirmation from the client. Right? So counseling is a process that is guided by theory. So what is a process? It is everything that the counselor does with the client, right? And then there is a very natural progression that takes place within the context of helping a relationship. And we need to understand that this process is very dynamic in nature. So the a counseling session can be effective when it is dependent upon what happens during the entire counseling process. The first and foremost, the key factor that is needed is to establish the rapport. What is a rapport? A better understanding between the counselor and the client. So once this rapport is established, the client will come up with the problem that he is stuck with. So the counselor will understand the kind of goal that needs to be set for this client, and what is the kind of an intervention that he needs to give. Right? So there are three major stages in the process. One, you develop the rapport, build a relationship, you work together in the relationship, and then you terminate the relationship. So each stage has its own qualities and its own problems. One major problem that happens here is the client starts developing some kind of feelings for the counselor, that is called transference. So most of the times it is transference that happens, but there is also a risk of counter transference. What is counter transference? The counselor developing some kind of feelings towards the client. So these kind of aspects should be really kept in mind, right? So there has to be rapport established, there has to be active listening, the counselor should show empathy, and he should also be very, very communicative, and there needs to be a positive regard towards the client. Sometimes the clients may be talking about something that's really scandalous, so the client cannot become judgmental about them, right? So all these aspects the counselor needs to bear in mind, and then if he feels that the sessions have been done to a satisfactory level and the progression in the client is also up to the mark, the counselor can terminate a relationship. So when should he terminate the relationship? And sometimes there will be resistance to termination, because the counselor wants to end, the client does not want to end, right? So if the at some point in time the client feels this is not working for me, he may go in for a premature termination, right? So this is yeah, what are the factors influencing counseling process? The structure, right? What are the characteristics, what are the conditions, what are the procedures, what are the parameters of counseling? All of these determine and influence the entire counseling process. Initiative: who has sent the client to the counselor? If it is the client who has come on his own volition, the change will come about quickly. But if it is someone else who has pushed the client to meet the counselor, it will take a little while for him to break the ice and then open up with what the real problem that exists in the exists with him, right? So there are various ways in which counselors can help clients to win their battle for initiative and achieve success in counseling. One way is to anticipate the anger that some clients may display. Another way is to show acceptance to whichever way the client comes. And a third way is to use persuasion. And fourth way is to use confrontation, right? And then setting, where should counseling happen? Counseling can happen anywhere, but mostly if there is a physical setting that is comfortable and reassures the client that he is the only person with the counselor and there is nobody else that is listening, there is more likelihood that the the client will open up fully, right? So ideally the counselor should keep in mind the solar technique, SOLER. What is SOLER? Face the client squarely. So the counselor needs to adopt a posture that indicates involvement. The client is talking on one end and we are like bothered about something, looking at, elsewhere, and we don't show interest towards the client. Not happening, right? So the counselor should show, his body language should show that he is interested in listening to what the client is sharing. O is open posture. So here we need to understand that half the problem or three-fourths of the problem can be conveyed through our verbal communication, but rest of the one-fourth can be conveyed through non-verbal communication. So we need to remember that the counselors need to have the skill to read non-verbal communication as well from the clients. Okay, so L is lean towards the client, be aware of their space needs. Then E, eye contact, and R, relax. So SOLAR is an acronym which serves to remind the counselors how they have to listen. The counselor's entire position or posture should be in such a way that the client understands that he has someone who is listening to them ardently, and he can open up and share anything with the counselor. So any counseling relationship or the very first interaction starts off with a first impression. If the counselor is able to make a good impression on the client, there is all likeliness that the client will come back, right? So clients generally come in all shapes and sizes, various personality characteristics, and different degrees of attractiveness, right? So some successful candidates are young, attractive, verbal, intelligent, and successful. And less successful clients are seen as hounds. They are homely, old, unintelligent, non-verbal, and disadvantaged, or they're called duds. They're dumb, unintelligent, and disadvantaged, right? So the counselor also should be aware of his own self. He should be honest, he should be able to communicate, and he should be knowledgeable, right? So this is as far as the process of counseling is concerned. I just want to take a small break, go drink a glass of water and come back. It will not take more than 2-3 minutes, please. Yes, I am back. So, yeah, we will now just fleetingly touch upon the various theoretical approaches to counseling. And here we see when we are talking about the theoretical approaches in counseling, we don't have anything that is totally different and something that we have not heard of earlier. We talk about the psychoanalytic approach that has been put forth by Freud. Then we have the phenomenological approach. Sorry. We have the phenomenological approach, which is also called the Adlerian approach. Then the person-centered approach put forth by Carl Rogers, existential approach by Rollo May, and Gestalt approach by the Gestalts. And then there is also the rational emotive therapy and the transaction analysis. Then we have the reality therapy and the behavioral approach. I would suggest these 2 hours are too short a span to be able to cover everything in depth. So uh, each of these approaches looks has a take on the human nature. Okay, so what is the psychoanalytic view of human nature? And then how do and what is the role of a counselor? What are the goals? What are the techniques that are used? So these are the four major areas as to how we can evaluate each and every approach, right? So what does psychoanalysis focus on? Its major focus has always been the childhood experiences, and Freud strongly said that any problems that arise at a later age could be traced back to a troubled childhood that the individual has had. And how did he recommend to solve the issue? Through free association, by interpreting the dreams, right? Or by analyzing the defense mechanisms that the client uses to deal with the condition, right? So, according to the psychoanalytic school of thought, human nature is considered as very dynamic, and he used the preconscious, unconscious, and the subconscious to explain human nature. And also, he used id-ego and superego to explain human nature. So, he said the id operates at the pleasure principle, superego operates at the morality principle, and ego operates at the reality principle. So there is always a tussle between id and superego, and the ego struggles to maintain a balance between the two. And in case there is, whenever there is an disequilibrium, people tend to uh, bring about equilibrium by adopting one of the many ego defense mechanisms. At times, there may be only one ego defense mechanism or multiple ego defense mechanisms that the person uses to deal with the condition in which he is, right? So, uh, uh, do you know of any ego defense mechanisms? Can you just tell me a few? You must have studied somewhere. Any one or two? Priya? I need some kind of a response.
Ma'am.
Yeah. Any one defense mechanism that you can recollect?
Ma'am, denial.
Very good. Happy.
Ma'am.
Yeah. Denial is one of the, and then
Projection,
ra-
regression.
yes, projection, then rationalization,
Yes, ma'am.
sublimation, displacement, repression,
Uh,
regression. All these are various defense mechanisms, right? Yeah. So people use these defense mechanisms to reduce the kind of threat they are facing, right? So, what is the role of a counselor? So, a counselor, when he is using the psychoanalytic approach, he encourages the client to talk. whatever comes to his mind. Remember, Freud has used free association with his clients. So, psychoanalytic approach counselors also ask their clients to talk whatever comes to their mind, and then they make an interpretation of what they spoke, draw a line to the childhood experiences, directional line to the childhood experiences. So, after a few face to face interactions, such an environment is created. The clients, they let themselves loose in the Freudian couch, right? The analyst will help the clients get insight by reliving and working through the unresolved past experiences. Okay, so the goal of psychoanalysis varies according to the client, but the focus is mainly on better personal adjustment, right? And then what are the techniques used? Free association is one. Dream analysis. So, talking about the dreams, Freud said that every dream has two types of content: one, manifest content, and two, the latent content. Manifest content is what we actually see in the dream, and latent content is all about the hidden meaning of what we have seen, right? So, and then another aspect is analysis of transference. What is this transference? Like I mentioned earlier, it is the client's feelings towards the counselor, right? And then interpretation. So all these aspects are dealt with in psychoanalytic approach. Then what is the Adlerian approach? So Alfred Adler's approach is also called individual psychology. So he gives individual the maximum weightage, right? And he was the one who spoke about inferiority complex and superiority complex. So, because Adler himself had struggled a lot when he was a child, and he was a very thin and puny guy, thin and lanky guy. He wanted to become an athlete, but he could not. But his elder brother had a very muscular physique and all that. So, I mean, he worked very hard towards getting there, and then he got the superiority complex. So he says always there is a battle of inferiority and superiority in an individual. So Alderian counselors, they function primarily as teachers, models, right? And they try to assess why their clients are oriented to a certain way of thinking and behaving. So as a client, as a counselor, he makes an assessment after gathering all the information, um, and he shares his own interpretations, impressions with the client. And then the client is encouraged to examine all this and change a faulty lifestyle by developing some kind of an interest towards whatever he has a problem with, right? So, what are the techniques that Adlerians use? Confrontation is one, asking the question, right? And then encouragement, acting as if. So, role play is one thing that is introduced by the clients, and there is this push button. Clients are encouraged to realize that they have choices about what they will pay attention to and what they will ignore, right? So, anything positive, what do we remember more? Positive we remember or negative we remember? It is human tendency to remember
Negative.
negative. Yeah, negative very easily. And then we also tend to get very vengeful on the ones who have brought about that negativity into us, right? So then we have this person centered therapy, where Carl Rogers introduced this, and he um, this is more of more emphasis is on self. Okay, so we see that Adler, uh, Jung, and Jung talks about what is Jung's analytical psychology. Jung and Adler are called neo-Freudians. Why have they been called as neo-Freudians? They though they were in the school of psychoanalysis, they disagreed with the overemphasis that Freud laid on the sexual instinct and the sexual aspects of everything, right? So yeah, now we are of course talking about Carl Rogers. Uh, Here he says that based on the belief that people have the capacity and the right to move towards self actualization. What is self actualization? To attain the highest level,
Yes, ma'am.
maximum potential of every individual, right? So, Rogers said all antisocial emotions that are there in us, all negative emotions that are there in us, are a result of our frustrations caused by the basic impulses. So he said, people are generally good. It is the circumstances that make them either good or bad, right? So he, according to him, people are always positive, they're always forward moving, they're always constructive and trustworthy. So we have an innate ability to reach our complete potential. We are born with this potential, but because of our experiences in life, we lose our connection. Okay, so it is just a matter of being disconnected from our self potential. So, if we are able to go back to our potential, then the problems that we are encountering may not be a problem anymore, right? So, while following the Rogerian approach, the counselor takes the role of a holistic one, right? So the counselor sets up and promotes a climate in which the client feels absolutely free, and he feels very free to explore all aspects of his self, right? And in the process, the counselor works towards developing or making the client independent, so that the clients are prepared to be open to experience the counseling. They can trust their own selves, they can evaluate themselves, and they will be able to reach their goal, right? So some techniques that are very characteristic of the Rogerian approach are unconditional positive regard. So regardless of the kind of problem with which the client may come with, the counselor will accept the client. Okay, so regardless of the kind of problem the client comes with, the counselor will show empathy. Okay, and the counselor will also be extremely transparent with the client. So unconditional positive regard, empathic understanding, and congruence are some of the uh, uh, techniques that a Rogerian counselor would use. Okay, then we talk about the existential approach. So one way, this approach does not take a curative approach, but it is more philosophical in nature. So it instigates the client to reflect, ponder, and search for meaning in life, or search for value in his actions, right? So who am I? Why am I? These are the things that uh, the counselor pushes the client into finding answers for, right? So the existential counselor focuses on helping the client achieve and expand their self awareness. So once we are aware of ourselves, the client can examine new ways of dealing with problems and will accept the responsibility of choosing a particular path. So, the goals of existential therapy are to enable people to become truthful to themselves, to take responsibility for their own actions and decisions, and to get the client believe to experience everything that he is going through, right? Uh, this particular therapy is not any technique oriented, because the counselor is driving towards attaining subjective understanding of the clients, what the client thinks of himself. So it is more to do about the client and with the client. So the techniques become secondary here, right? And then Gestalt is another approach. So this is an integrative orientation. It focuses on whatever is there in the client's awareness. Okay, so what is Gestalt? A whole, right? So Gestalt counselor will help his client to work through the problem and move beyond the problem. Okay, so the counselor will pay more attention towards the client's self-awareness, towards the client's non-verbal language, verbal language, and see if there is any inconsistency between the verbal language and the non-verbal message. Okay, so here the focus is on what is the current aspect. Okay, so there are four major principles of Gestalt therapy. One is holism. The whole person is taken into purview. Then there is this figure formation process, right? Whether it is in the foreground or the background. So yeah, all these are also taken into consideration. Some of the very innovative techniques that the Gestalt counselors use are exercise and experiments. So these are techniques that the counselor can use. You could use role play, you could use psychodrama, you could use confrontation, right? And experiments are activities that the counselor can use with his clients to bring about more interaction, right? So then we have something called the rational emotive therapy. Albert Ellis and started cognitive behavior therapy. So cognitive behavior therapy has kind of revolutionized the entire counseling arena, because the counselor here works towards bringing a clearer understanding in the client, right? And he helps the client to overcome his problem through his cognition, and through the cognition bring about a change in the behavior. Okay, so one of the ways in which CBT is conducted is also REBT, the rational emotive behavior therapy. So the counselors are active and direct in this approach, and they act as instructors who need to teach and correct the client's cognitions. So the moment the client feels, I am very, very low on my capabilities, the counselor tells the client, turn that sentence into a positively worded sentence. Anything that takes a negative course will be encouraged to be changed into a positive dialogue or an outcome, right? uh, yeah, then yeah, we spoke about transaction analysis. uh, in transaction analysis, the counselor plays the role of a teacher, and he helps the client obtain the tools that are necessary to bring about the change in the present. So uh, there are a number of techniques that the transaction analyst will use. First one could be the structural analysis, then the transactional analysis, games people play. Eric Byrne is the one who is associated with the transaction analysis. So you could read this. This itself is a huge volume. Okay. Then how can behavior be brought about? How could people be helped to change or overcome their problem? We take the behavioral approach. When we are talking about behavioral approach, the two basic things that come to mind, or three basic things that come to mind, are classical conditioning, operant conditioning, and social learning or social cognitive approach, right? And then cognitive behavior therapy also comes in here, right? So CBT has gained a lot of traction. There is a lot of popularity. You want to be trained in cognitive behavior therapy, you spend a lakh of rupees. We have people coming from abroad to India conducting workshops where you can be a part of it and get certified as an REBT therapist or a CBT trainer, right? So there are quite a number of options available in terms of solving the problems for the clients, right? You can, with this kind of an exposure, I think you can just go ahead and study so that you will understand. Why should, now talking about ethics, uh, I think I can actually go on for 2 hours only for one unit, and that way I will need around 8 classes or something. But yeah, I reiterate again, um, a lot of it is self-explanatory and extremely interesting for you all to read and understand, right? So we are now looking at the ethics part. What are ethics? Counseling is not a value free or neutral activity, but it is a profession based on values, right? Why values? Integrity is what is expected of the counselor, confidentiality of the problem is what is expected of the counselor. So ethical counselors should operate ethically, and they should display care and wisdom in their practice, because physical health could be discussed, but mental health, people wish to keep it very, very private. They really don't want to talk in public about their own condition. I think it is the celebrities who have popularized that it is okay not to be okay, and it is okay to talk about your condition to a counselor, right? And that is the reason why we see a huge surge in the number of counselors also. Similarly, each one is also handling a multiple variety of clientele, right? So ethics are norms that have been set, the guidelines on which the uh, counselors need to operate, right? So why should we have these ethical codes? It will protect the profession. Ethical standards help control any kind of internal disagreement, and ethical standards protect practitioners from the public also, right? And they also uh, provide the clients with some protection from incompetent counselors. Okay, so we need to be trustworthy, need to show certain amount of autonomy, beneficence, and we should not bring any malice to the table. Then we are very just in our approach. So there are professional codes of ethics. We have the ACA, American Counseling Association, which is a non-profit professional and educational organization that is completely dedicated to the growth and enhancement of counseling profession. So they have a lot of codes of conduct, and in case we violate any of them, then we will be stopped from practicing counseling, right? So yeah, we spoke a little about ethics in counseling is over. Yeah, so your unit 2 is more or less about yeah, the counseling models and approaches. What we have discussed in brief here, you will be learning in depth in unit 2. I mean, I think I have a very few people as audience here, so maybe I will not be able to get right kind of an understanding. But how many of you are interested in counseling? We have, I think, five. Okay, Java, Arita. Okay, so yes, quite a number who's interested. That's nice. But yeah, do I mean, male counselor or female counselor, whatever it is, that the characteristics needed in both are the same, right? So, unit 1, we've been exposed to various theoretical approaches to counseling. Unit block 2 is an elaborate procedure of the same. Okay, block 2 is extremely elaborate and you could learn step by step, and I would suggest you read everything thoroughly so that you know the fundamentals right, you know the differentiations right, what is CBT and what is REBT, why are they different, or is there any difference between one another or no, if at all there is a difference, what is the difference between the two. And then we have the person centered therapy and the solution focused counseling. So I would recommend that you go through all of these very, very carefully. So, next two blocks talk about different types of counseling and counseling for mental disorders. So, counseling for mental disorders, we can also say, yeah, your course has identified mental disorders, but we can also say counseling for children with disabilities or children with special needs. Now, only those children who are with special needs alone need, I mean, they alone are not in need of counseling. Sometimes you will also see that the parents are in need of counseling. Okay, so yeah, HIV AIDS counseling. So here, if you see, HIV is the stage immediately after detection. For it to convert into AIDS, there's a cycle that needs to complete. So, if the condition is managed really well, the person can delay the onset of AIDS. So, what I'm trying to say here is uh, management of the disease becomes easier if these people avail the services of counselors. So, whether it is a diabetologist or whether it is an infertility specialist or whether it is a psychiatrist for that matter, all doctors by profession do not have the time and patience to sit and listen and counsel their patients. So, who can make the best use of this busyness of the doctors? We as counselors. Attach yourselves with the infertility specialists. You can see the very many conditions in which those patients come in. They are sometimes very upset because they were unable. Infertility means IVF treatment for children, right? I mean, the parents undergo to conceive. So, if it fails, month after month, they look forward to conceiving and it is not happening. So, they are exasperated with their efforts. They do not have the time or money, right? And so they cannot sit and talk to the doctor about all this because the doctor appears to be busy. Who can pitch in there? It is the counselor. Then diabetes is another condition which can be managed very well. Now, does everybody know how to manage diabetes? No. It is here that the health counselor can play a very pivotal role, right? So then you see addiction or anxiety. Like I was mentioning earlier, NIMHANS has a course on tobacco cessation. So many people are addicted to smoking, addicted to nicotine, and now they are saying sitting is the new smoking. So even we people who sit for long hours need to ensure that we are moving out of our space at least once in every hour, right? So there are various such conditions which the counselor could also add to and make the lives of their clients easier. Okay. And then depression. So depression and anxiety are two conditions which cannot be completely managed by the counselors. So ideally we can administer the PHQ-9, which helps us identify the levels of depression that are there in a person, and depending on the level we need to recommend the client to see a psychiatrist. Because recently I've had a case, I dealt with a case where the lady was identified with moderate severe depression. So she needs medication, but she already used medication and she got some side effects which she's totally unhappy about, and so she doesn't want to go for any kind of a medication this time around. Okay. So then there are various personality disorders, gender identity disorders, eating disorders. Under eating disorders, probably we could talk about bulimia nervosa and anorexia nervosa. Okay. So it's all an effort to maintain an hourglass figure and stuff like that, which becomes extremely taxing on the uh, adolescents, and they end up in a lot of eating disorders. Okay. So uh, we need to bring to light that you don't have to deprive yourself to be having a size zero figure, but if you eat the right kind of diet and follow the right kind of exercise pattern, you will not have much of a problem. So we can talk about anorexia nervosa and bulimia nervosa under eating disorders. Okay. So, and then personality disorders. There are personality disorders are really very vast. So have you any idea about what these personality disorders are? OCD, right?
Yes,
So
ma'am.
we
Yes,
hear
ma'am.
about yeah, OCD can be a disorder, but OCD it can also be a personality, right? So these people have distorted perceptions of reality, and they show abnormal behaviors and distress towards many things. So there are paranoid personality disorders, schizoid personality disorders, schizotypal, cluster A, cluster B, cluster C, right? So under cluster B, we have antisocial personality disorder, borderline personality disorder, histrionic personality disorder, and narcissistic personality disorder. If you've done your psychopathology paper or the abnormal psychology paper, you would have already done all of these, right? But here they come of more importance because we are trying to see how we can help them overcome these disorders, right? So sometimes when the anxiety levels are high and depression levels are high, the patients would need anti-anxiolytic drugs and antidepressants to bring them to normalcy. And when it is coupled with counseling, the result is going to be quicker. Okay. So you see that a lot many things. Yeah, one more aspect that we could discuss is about educational and vocational counseling, educational counseling or career counseling. Many people and parents, so students and parents are always at crossroads as to which is the most preferred career choice for my son, and you decide for the son and put the son in that particular stream. Ultimately the son has become an underperformer, loses all his self esteem and self confidence, and now he has become a problem on hand. So we do not want such a thing to happen to young minds and young children. So awareness sessions about various options to the parents also becomes essential. So we have career counselors, we have educational counselors, and we have vocational guidance counselors also to spread awareness about the various avenues that are available that the children could choose, right? So these are just a few of the many kinds of counseling that are existing right now. Okay, we have premarital counseling, marital counseling, family counseling, uh, you name it, and we have experts for that, right? So I think I will just stop here for now, and we will discuss if you guys have any questions, if you guys open up about something. And it would be extremely reinforcing for me if at least one or two of you will come in front of the camera.
Ma'am, I have a question.
Yeah.
Like, uh, like it's on the both sides. Like, a client comes to me, for example, if I'm a counselor, then even my perception of seeing world might be different. So I would be suggesting him the way I see it rather than how he is seeing. So how do you think that it will affect? Because, for example, I have recently met few people. Then there was a old aged woman around for 56 or 57. Then when I was talking to her and saying that okay, I'm doing psychology and I'm going to become this, then while I was asking her, then she has this problem of saying lies a lot. So her perspective towards me has become ki if I'm saying lies or not. So she's asking me questions in that sense. So uh, if that person becomes a counselor, then how it would impact the clients they are coming to meet her?
So if that person who is
Am
constantly
I clear?
lying
I don't
becomes
know.
a counselor, no, no, correct me if I'm wrong.
Yeah, tell me.
If that 57-year-old lady becomes a
Okay,
counselor,
perfect.
she is a
Uh,
constant liar.
yeah,
How
means
will she
she
succeed?
succeed in
Or
her
will she be a good counselor?
perfect, perfect, correct.
Okay. See, first and foremost, is she interested in the field?
Depends, of
And
course. Hmm.
counseling is not all about lies or anything. It is about using the techniques to help the client.
Client,
Okay.
perfect. Hmm.
And then the counselor needs to affiliate himself or herself with a specific school,
Hmm.
like pick up any no here again I would want to clarify,
Hmm.
sometimes you may use only a single approach, or you may want to use
Hmm.
a mix of two approaches, okay, depending on the
Correct.
case
Hmm.
on hand. So each
Hmm.
case is a unique case. So that is
Hmm.
why it becomes essential for you to understand the fundamentals of every approach.
Hmm.
Okay. And
Okay.
if one approach has worked well for a client, it is not necessary that the
Hmm.
same
Correct.
approach and the same style work for another client.
True. 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 Hmm.
Okay. So
Hmm.
this lady should be able to have that integrity. Okay.
Hmm.
And
Hmm.
I don't know how far she'll be able to do justice to the field that she has
Profession.
chosen.
Right.
Yeah. Yeah.
Ma'am, one
And
more thing.
that is what, sorry to interrupt, ma'am, and that is what ethics is all about, which we have discussed
Yes.
in today's class.
Yeah,
Integrity.
integrity is
Integrity.
one major aspect. And when you lie, you don't become a trustworthy person.
Exactly.
And a client counselor relationship operates so heavily on trust that is built over a period of time.
Hmm.
Without that rapport, without that trust, you don't see that the client opens up freely to you.
Exactly. Ma'am,
Okay.
one more thing.
Yeah,
Choosing
I
like
just wanted to one second. I just wanted to share a case and I forgot the case.
Mhm. Okay,
Yeah, you please go on. If I recollect, I will share it with you all.
sure, ma'am. Ma'am, even psychologists might have their kind of traumas or depression or
Yeah, definitely.
personality disorders, definitely.
And
So they
and
chose.
you know the
Huh,
saying, psychologists are the most psyched up people. That is what
correct,
the word goes
exactly.
around.
So true, so true. So if they are dealing like I suppose that these people are kind of people who found out that they have these kind of problems and they want to solve it, and they don't want other people to see that okay they are also going through, so they want to help them. That's the reason why preferably most of the psychologists have become psychologists. So at times, these stories that preferably psychologists say while during the course of guidance or the counseling, uh, they would put their stories into life so that they could enter into the mind of the client so that he could
Okay.
express himself. Is that correct or not? What do you say, ma'am?
See, without revealing the identity of who the person is,
Hmm.
the client can give umpteen instances, sorry, the counselor can give umpteen instances to the client.
Hmm.
If the counselor feels
Hmm.
it will help in the process of therapy. Okay.
Okay. Hmm.
So, one human tendency is to know that someone else also is in a similar kind of a predicament,
Hmm.
could be soothing to the ears,
Hmm. Hmm.
right?
Hmm.
So the counselor can make use of such instances, drive home the point to the client,
Hmm.
and also say that that client has been successfully able to overcome the problem.
Definitely.
You 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 tend to highlight the positives of the case that you are sharing with the client.
Hmm.
That might have a positive impact. And
Okay.
whenever
Hmm.
you are sharing details like this, ensure
Hmm.
that you are not revealing the complete details of that case, of the identity of the client of that case,
Hmm. Okay. Sure.
right?
Ma'am, in after listening to this 2 hour class, then I found out the life of a counselor is very, very tough because he
I
needs
can
to
I can
have
assure
all
you
kinds of
I
skills
can assure you of that. Yeah, I can assure you of that.
because
Because
he needs to.
like
Hmm.
I was mentioning about this couple, right?
Hmm.
So who want to still hold on to each other for the sake of their 6-year old son.
Hmm.
They are like they want to have a session every alternate day.
Okay, that's quite
Whatever
tough.
whatever suggestions are being given, you need to
Hmm.
implement those and see if it is working between the two of you. See for at least a week,
Hmm. Hmm.
and then going for some kind of another bout of counseling. Okay. And then
Hmm.
especially if one of the couple has anger issues,
Hmm.
you could work on anger management through meditation, through deep breathing, through exercise.
Hmm.
And for that to give any kind of a result, you need to be invested into the entire program for some time,
Hmm. Hmm. Of course.
right? But it so happens that they want a quick remedy, which is
Which
not
is
at all
not
possible.
possible, especially in terms of psychology. Yeah. Ma'am, in that case, that
Yeah.
I was asking, okay, this person needs to be the perfect fit guy, I suppose, because he needs to speak well, he needs to know that how to modulate his voice at what point of time, and he needs to understand the other person's perspective. He should be intellectually very strong so that he needs to lower down his guards to let the other person be vulnerable, and he needs to be vulnerable at the same time. uh, and he needs to have good habits, so that, because unless and until if he can't express that, okay, if I'm, for example, if I'm addict to cigarettes, then I should not say that you should not have this. So he needs to be value based, respectful. So it's a
See,
very,
that doesn't mean the counselor should not smoke.
I mean,
The
just it's
counselor
an
can
example.
the counselor can smoke. Yeah, that's what
Hmm.
I'm trying to say.
Hmm.
Counselor can smoke, but
Hmm.
I am sure that the counselor knows what is the right amount of smoking.
Okay.
So the same thing holds good even for the client.
Hmm.
Okay, he can tell the client that he should not be addicted to it.
Hmm.
But you see, someone who's gotten addicted to it,
Hmm.
to come out of the addiction and to be able to normally smoke just two or three or socially smoke is a major challenge.
Hmm. Very,
See,
very.
all
It's
said
a.
and done, yeah, all said and done, even counselors are humans, right?
Hmm. Yes,
So we
definitely.
cannot
They
expect
too
them
have
to
their
be very
emotions.
same. Yes,
They'll be
yes.
meeting multiple people in the same day, and they have to be empathized with every single person. So how his mind should work, and his heart, his emotions, they are frustrated, obviously.
So the counselor needs to draw a line as to how many people he wants to see in a day.
Hmm. Hmm.
Okay, it is very, very draining emotionally.
Hmm.
So you as a counselor should be able to master the art of detachment.
Hmm. Hmm. Cool.
You so here I would like to share my own experience again. The very first case that I had handled was in a school where
Hmm.
the child came up to me and shared the ill treatment that was meted out to her by her mother,
Okay. Hmm.
how partial she is towards her brother, and how impartial, how rash or brash, you could say, she was
Hmm.
towards her.
Rude,
In
preferably.
the
Hmm.
process,
Hmm.
the girl was crying, and I cried along with the girl.
Hmm. Hmm.
Okay, so you see, that was my very first experience.
Hmm. Hmm. Hmm.
We need to be attached to our client with a certain amount of detachment.
Definitely. Hmm.
So that very day, I knew probably I am not fit to be a counselor. But
Hmm.
that
Hmm.
happened that happened around 15 plus years ago,
Ah.
and I have evolved over time,
Hmm.
and now I know where I need to control my own emotions. I ensure that they do not spill over
Hmm.
into my client's area.
Hmm. Wonderful.
Yes, ma'am.
Yeah.
That's it from my side, ma'am. Ma'am, one more thing, small question. Like
Yeah.
in terms
Yeah.
of counseling, so we have got to know that why we are doing, how we are doing, what we are doing. But can we suggest people, okay, if this is how you would do, then it would be great for you.
So it is always about suggestion.
Suggestion. Okay.
It is not about a decision that the counselor is taking on behalf of the client.
Hmm. We'll giving them the perspectives, like, okay, these are the things that you could choose on, and
Yes.
based on their
Yes.
their
So
ideology, they will choose accordingly. Okay. Perfect. Perfect.
exactly. Because tomorrow the client should not turn around and say, "You are the one who asked me to do like this and see what happened."
Yeah, definitely. Yeah, sure, sure.
Right?
Sure, ma'am.
So this could be a disclaimer.
Hmm.
And another disclaimer I give is I tell them, please do not expect a cure within a week. It
Obviously,
is not possible because counseling is a time taking process.
because most of the people tend to have the same problem over and over again in their entire lifespan. So it builds up into a position where they can't even notice that they have it. So
Right.
in one sitting or in three, four sitting, how they could expect that, okay, this will be washed off all of a sudden? It can't happen,
Yeah.
definitely.
Can't.
Sure. Thank you, ma'am. Thank you very much.
Right. Anything else?
Ma'am,
Yeah.
What is psychodrama?
Psychodrama is a little bit closer to role play. You understand what is role play?
Yeah, ma'am. Yes, ma'am.
So psychodrama is a form of a therapy, right? Where
Ma'am.
people act out any kind of their psychological issues. Here, role play could be for anything,
Yes,
but
ma'am.
psychodrama is specifically for the kind of conflicts that you are experiencing.
Okay, ma'am.
Okay, and
Yes.
majorly used to handle traumatic cases.
Okay. Yes, ma'am.
Okay, role play could be anything. You could use it in organizations, you could use it for HR settings, you could use it to explain any concept, role play.
Yes. Yes, ma'am.
But from a more therapeutic perspective, psychodrama helps handle traumatic situations.
Fine, ma'am.
Yeah,
Thank you.
right.
Any other questions?
No,
And
sir.
again, we have class on 3rd,
Okay, sir.
MPCE 22, and MPCE 23 on 4th. 5th and 6th is MPCE 46 positive psychology. So we have planned like that, and already we have sent the schedule to all the learners. The attendance is very poor because we have nearly 15 students. But anyhow, attendance
5
is not,
chapter.
not mandatory for this online counseling theory. But practical component attendance is compulsory. They know all the students. So we are planning to conduct practicals in the month of March end or April month. So based on the availability of the counselor, we plan it and will inform you. So this is from Regional Center Vijayawada side. And you have to submit your assignments on or before March 31st, but sometimes university may extend the date. And internship already last Friday I have informed that also you have to submit on or before May 31st or April 30th as prescribed by the university. So we have not received exact date. Once we receive that date also we will inform you. So okay, thank you madam for
Thank you, sir.
sparing your valuable time for our IGNOU students. So
Thank you,
again we'll
ma'am.
Thank you
meet
so much.
on third.
Right.
Thank you.
Yeah, sure.
Now the
Right.
session is closing. Thank you.
Okay.